Victoria, and I'm excited. I'm flattered that you asked me to talk to your group, and I think it's so cool that you have a medical club in high school. I certainly never had a medical club when I was in high school. As I was thinking about this talk that I was going to have with you guys, I thought, boy, it's been 42 years since I was in your shoes, and I was about your age, and thinking about what I wanted to do with my life. And my shoes are kind of pretty similar to your shoes, because I went to Glenbard West. I don't know if you know that. So I graduated from Glenbard in 1980. We had no medical club. But when I was in high school, I always knew I wanted to go into medicine. I had no history of medicine in my family. I had no relatives who were doctors. I'm the first. I had no interaction with the healthcare system because I was never sick, but somehow I knew I always wanted to go into medicine. And I think that the reasons were, I always knew I wanted to do something with my life that was important. I wanted a job that was valuable. I wanted a job that was hard, that was important, that was hard to get there, that the road to get there was difficult. I wanted a job that not just everybody could do. I wanted a job a career where I significantly impacted people's lives in an intimate way. And ultimately, I wanted a career that was based in science, because of all things, I love science. So nothing checked all those boxes better than medicine. So I always knew, even before I was in high school, I somehow knew I wanted to be a doctor. And then I graduated from Glenbard, went to college, went to the University of Notre Dame. I was pre-med there. And then I went to the University of Illinois at Chicago for medical school. And I don't know if you guys all kind of understand exactly how medical school goes, but generally the first 2 years of medical school are didactic, where you're in the classroom. And the second 2 years are clinical, where you work in the various clinics and work with the doctors and get exposed to the different fields of medicine, maybe 3 months in internal medicine, 3 months in general surgery, 2 months in obstetrics and gynecology, a month in psychiatry. And when I went to medical school, I really didn't know what I wanted to be. I really didn't have a clue. So when I did my clerkships, I really threw myself into my clerkships and gave it everything I had, because I approached everyone like maybe this is what I was going to go into. So I really enjoyed everyone I went into. I really learned a lot. And I performed really well in all of them because of that. But it didn't help me get to the end point and figure out what I wanted to be. So I thought, as I was getting towards the end of medical school, well, maybe I'll be an internist, and then I'll become a cardiologist. And that's a good job. That's a good career. But I thought, every internist sees a lot of rashes. So maybe I should do an elective in dermatology so I can be a really good internal medicine doctor and no rashes. So towards the end of medical school, I did an elective in dermatology. And when I got to the derm department, I realized it was different than any other area I'd been in medicine. Number one, the doctors were all really happy. They were happier than any other doctors I worked with. The doctors were really excited about what they did. They were really passionate about what they did. They were really enthusiastic about their field of medicine, about dermatology. I realized other things about derm when I was there. I realized that dermatologists see every age of patients. They see newborns, so babies that are born with congenital syndromes or disorders or birthmarks or tumors or infections, the dermatologist saw. And we see toddlers, and we see adolescents. We see people, your age. The most common reason why teenagers go to the doctor is for acne. So I see tons of teenagers, and I love seeing teenagers. We see adults, we see elderly, we see tons and tons of cancer. We see more cancer than the oncologist sees cancers. So we see lots of older people for cancer. Skin cancer is by far the most common cancer that humans get. Skin cancer is more common than the 4 most common cancers combined. 1 out of 4 people on this call is going to get a skin cancer. That's how common skin cancers are. So we see all types of patients. And the breadth of disease that dermatologists see is amazing, the variety of diseases that we see. There are more named diseases in dermatology than there is in all of internal medicine combined. And we see some of the craziest and most interesting things. Every day in clinic, we see really, really interesting things. I also realize there's many opportunities in dermatology to subspecialize. So you can be a pediatric dermatologist and only see kids. You can specialize in adult dermatologic disorders. You can be a dermatopathologist and sit at the microscope all day and specialize in pathology of the skin. You can be an occupational dermatologist and figure out why people get certain rashes in the workplace. You can be a specialized skin cancer surgeon. We call that a Mohs micrographic surgeon. And they spend all day removing cancers and then cosmetically fixing those defects that they make. Or you can be what I am, and that's a cosmetic dermatologist. And I spend my day helping people to achieve their aesthetic goals, to look the way they want to look, to get rid of things that they don't like, to reshape their bodies to be the way they want it to be. So that's how I spend my days. But probably the thing that more than anything when I was in derm was kind of my epiphany about why this field was so special is that dermatologists have this almost magic ability to walk into a room and immediately make a diagnosis, different from any other field of medicine. I have had many times in my career that I've been called to the hospital to see a patient who's been in the hospital for a week or two, has been seen by multiple specialists, internal medicine, surgery, infectious disease, rheumatology. They've had $50,000 worth of tests and nobody can figure out what's going on. And then somebody says, well, let's have the dermatologist take a look. And I come over and we open the door, I open the door, and from the hallway, I know the diagnosis. And I think, gosh, I could have seen this patient in my office and in 5 minutes made a diagnosis and taken care of the patient for about $100. And now this patient has a $100,000 hospital bill. So that's a unique thing that dermatologists can do. And it's really kind of a cool and special thing. But let me flash forward 30 years. So I've been in practice for 30 years. And I guess the question is, well, what do I think of being a dermatologist after all this time? And I would say I have the greatest job in the world. I love my job. There's not a day that I don't get out of bed excited to go to work. There's not a day that I'm at work that I don't see something really fascinating and really cool. There's not a day that I'm not challenged at work, to think and figure a problem out. And there's not a day that I don't feel that I spent my day doing really important and rewarding things and helping people with their problems. So I really love my job. There are surveys done of physicians every year where they look at all areas of medicine and ask, are you happy with your job? Would you choose your specialty again? Many different ways they ask the question, but every year, the number one category for job satisfaction amongst doctors is dermatologists. So dermatologists kind of uniquely love their work. So that's kind of my quick overview of from your age to where I'm at now. Let me show you guys just like a brief 5-minute video, and it's going to run you through a number of procedures I do that I can just kind of show you. So here I'm doing a biopsy. This is a little growth on the forehead. It's probably a skin cancer. So we send that for pathology. I do this about 20, 30 times a day. And if that's a cancer, then we'll go back and remove it under local anesthesia in the office. That's a run-of-the-mill kind of thing we do. Here I'm doing cryosurgery. So I'm spraying liquid nitrogen on these skin growths. These are called seborrheic keratoses or benign skin growths. And that will superficially eliminate these growths. So I'll take all these off the skin aesthetically for this patient with liquid nitrogen. This patient has what we call ice pick scars. So these are scars from acne. And I'm doing a chemical peel in those scars, which will induce wound repair and new tissue, which will close those little holes in the skin. A large part of my practice is removing scars. This isn't someone about your age, a 17-year-old with red acne scars. And I'm using a laser called a pulse dye laser to remove the redness from the skin. This is a laser called an erbium laser. These are little tumors on the eyelid. If you can get oriented, that's the eyebrow. And the laser is vaporizing the tumor. So it's making them essentially just disappear. And this is being done under local anesthetic. So a big part of my day is lasers. We have like 20 lasers in the office that I spend the majority of my day using. This is a tattoo. So we're using a laser called a Q-switch YAG laser to remove this tattoo. And this is a common thing we do. We kind of take it for granted doing tattoo removal because it's such a mundane thing we do all the time. But when you think about that, we have the ability to send photons into the skin to destroy things such as tattoo ink and not injure the skin or scar it, is a pretty amazing thing. And if we had more time, we could talk a lot about that. I'm doing what's called sclerotherapy. This is a leg with spider and varicose veins. And I'm injecting a medicine into the veins, which you can see is instantaneously clearing the veins. Pretty neat, pretty cool. That's called sclerotherapy. And here I'm doing Botox. These are Botox injections. So Botox is botulinum toxin. This is the most commonly done cosmetic procedure in the world. The medicine is paralyzing the muscle, and we inject it into muscles of facial expression that cause wrinkles. So it's a way to eliminate wrinkles. This is very sped out. I'm doing an injectable filler on this patient. I work very rapidly. And that's to reshape her face, to make her look younger and eliminate wrinkles. Actually taking the patient's own fat. In the syringe, you see the yellowish gold material. That's her fat I removed from liposuction from her stomach, and I'm injecting it into her chin. She was born with a small chin, and I'm rebuilding her jawline with her own fat for permanent correction. Dr. Pimple Popper? Well, that's because Sandra Lee is a dermatologist. And I don't know if any of you guys watch Dr. Pimple Popper, but her show is a lot like my day. It's very similar. So the things that she does and the things that I do are very similar. And the big things that you see in her show is kind of the things we see, all the time in our office. I was going to take like 2 minutes, Victoria, and I just kind of wrote down quickly a few thoughts of some advice that I would have for you guys, for myself when I was your age, looking at a career in medicine. So let me just take a couple minutes. And my first piece of advice is, if you want to go into medicine, absolutely go for it. It is a long, hard road, but the reward is the most honorable career possible. So if you think you want to do it, go for it. Don't let anyone tell you can't do it. Learn to manage your time well from the beginning of college. The most common significant problem that freshmen have is time management. So from the very beginning of college, get into good habits of time management. Make yourself schedules, stick to it, and you'll do great. The most common problem that young people have is when they have to manage their own time, they don't do well when they have all this freedom and all these options of things to do. Number 3, your schoolwork always comes first. You can do many things and deeply immerse yourself in college, but your schoolwork always comes first. Always get that done first. Number 4, keep balance in your life. Schoolwork cannot be all you do. Now, schoolwork should be the first thing you do, but it's not the only thing you do. You want to have balance. Number 5, and maybe my most important advice to you, sleep at least 8 hours every night. Okay? I can't tell you how important that is. Never sacrifice your sleep to study. It's a bad strategy. Don't sacrifice your sleep to study. Be prepared, be worked ahead, planned ahead, so you can get your sleep. When I was in college, I got 8 hours of sleep every night. And I particularly got 8 hours of sleep every night prior to exams. So be studied ahead so you can get a good night of sleep before an exam. Never pull an all-nighter. It is the worst thing you can ever do. It is the worst strategy to be a good student. I only did it once. I tried it once in medical school, and it was the worst mistake I ever made. So never pull an all-nighter. So people will do it all the time. It's a bad, bad strategy. Good students don't do it. Number 6, never go out on a weeknight. Never miss class because you were out partying the night before. If you have class the next day, you don't go out. You know, if you were an athlete and you had a game or a competition, would you go out partying the night before your game or your competition? You never would. And every day you go to class, if you're pre-med, it's your next competition, you know, that you have to be in peak shape to do the best you can. So always go to school well prepared. Never go out the night before class. Number 7, take good care of your body. Eat well and exercise. Your brain will function better if your body's healthy. And number 8, don't stress the process. Be confident that you'll achieve your goals so that you can enjoy the process. If you're committed to doing the work, you'll get there. You'll get it done. So there is no reason to stress about it. I have 4 kids. They're all older than you guys. What I would always tell them when they were your age, and they would get stressed about school, and they wanted to do great, and they wanted to go on to the best college possible. And if you guys are in the pre-med club, you're probably all that way in type A people. Don't stress the process. What I always said to them is life is like a river, and you're in the river, and the water's going past you. And when it goes past you, you can't get it back. So enjoy the water while you're in it. Enjoy the process of being a pre-med. You'll get there and you'll make it. So those are all my thoughts for you guys. If you have any questions, I'd be happy to take them. I'll give you the exact example of the case one of the cases I was talking about. It was a 15-year-old. So again, like your age, you know, around your age, with a incredibly swollen rash on the scalp, a lot of pus, draining pus, hair loss, African-American patient that the pediatrician admitted, put the patient on IV antibiotics, thought it was a bacterial infection. Patient didn't get better after a week in the hospital on IV antibiotics. Patient had no fever, no chills, got hospitalized anyways, called general surgery in to biopsy his scalp. He got taken to the operating room, got put under general anesthesia so they could take up his scalp. Called infectious disease to come in and look at him, changed antibiotics. So this went on for 2 weeks. And then we got, you know, I got called and opened the door, and it's like, he's got ringworm. You know, he's got a fungal infection. And the fact that I mentioned his ethnicity was that ethnicity is more prone to having this kind of exaggerated, inflamed response to ringworm. So that would be something that in the office, I would walk into the room. I would actually probably know the diagnosis when I read his chart before I went in the room, just from the description. And we could simply pluck a hair out, you know, from his scalp, take it to the microscope and see fungus in the hair. And we give him a prescription for a medicine, and he'd be on his way. And that would be the end of it, and he would be cured of it. So, I mean, that's a pretty good example of things we see. You know, things like more complicated diseases like lupus, you know, which are complex, multi-system inflammatory processes that will often take months and sometimes years before the internist and collectively with the rheumatologist can put all the evidence together and make a diagnosis. You know, we'll often, again, just come into the room and see a rash that's indicative of lupus and come to that diagnosis, or take a skin biopsy, which literally takes us like a minute to do, and that'll prove the diagnosis. To be thinking about skin cancer and wrinkles. So you couched those two issues together. You know, you talked about skin cancer, but you also, I think you mentioned wrinkles, right?
Yeah. I wish they didn't exist, but they do.
Yeah. Yeah, me too. So your age, it's good to think about it, but as you realize, you know, kind of the cat's out of the bag a little bit. You've already had 2 skin cancers, and you know, every day we're getting more wrinkles. And I always tell my acne patients who are, you know, generally high school age, your age is the time to think about not getting skin cancer. To think about it when you're 50 and you get your first skin cancer, it's kind of too late in a sense, because the damage to your skin that's going to cause your skin cancers at 30 or 40 is happening at 1 year and 2 year and 15 years. The wrinkles that you'll see in the mirror at 40 that you hate are developing when you go lay out at the pool, at 14, or when you go to the tanning bed at 18. So when I tell my patients who tan, I say, well, I hope you love your tan at 18. Let me say that again. If you love tanning at 18, I hope you love your wrinkles at 28. And I hope you like your cancer at 35. So the most important things you can do, number one, never go into a tanning bed. I mean, the worst thing you can do for your skin is go into a tanning bed. Now in Illinois, because of dermatologists, you can't go into a tanning bed till you're 18. It used to be that any age could go, but the Illinois Derm Society pushed this legislation through that push your age up to 18 to go to a tanning bed. But one trip to a tanning bed increases your lifetime risk of melanoma by 50%. 50%, think about it. But the sun outdoors, is injurious to your skin, just like a tanning bed is. So the most important things you can do is protect your skin from the sun avoidance, sunscreen. If I could go back in time and do something differently, I would wear sunscreen every single day, from the age of, as young as I could, from as an adolescent or younger. Wear sunscreen every single day. Don't think about the weather. Don't think about the temperature. Don't think about if it's raining or it's cloudy. You're getting UV radiation every single day. And it's your total cumulative dose of UV that does the damage, that causes your wrinkles, at 30, that causes your skin cancer at 30. I have 18-year-olds with skin cancers. I don't see them as much anymore, but I used to see them when teenagers used to go to tanning beds, and I'd have 18, 16-year-olds with skin cancers, not so much anymore. But that's the most valuable thing you can do. And I always tell my patients, you don't wear sunscreen so you can be in the sun more. You wear sunscreen for when it's unavoidable to be in the sun. Powdered sunscreens are not as effective. So a lotion is more effective. So powder don't give you the same coverage as a cream or a lotion. But in regards to sunscreen, what I would tell you is you want to look for a sunscreen with an SPF number, I say 50 or above. Okay, so that's kind of the baseline. However, there's more to sunscreen than that. Everyone seems to focus on the SPF number. And most people don't really understand what that means. So the SPF number, SPF stands for sun protection factor. And that means it tells you how much longer you can be in the sun without burning than you could naturally without it on. So an SPF of 50 means you could be in the sun 50 times longer without burning than you would on your own. However, there's different types of UV, and most of you may know this. There's UVA and there's UVB. UVB burns you. UVA does not burn you. SPF number only tells you about UVB protection because it's only a measure of burning. So you could have an SPF of 100 and your sunscreen has no UVA protection. And UVA is just as important as UVB in terms of aging you and causing cancer. In fact, it's probably more important because it's a longer wavelength of light. So it penetrates deeper into the skin. And that's just the physics and the optics of waves. Longer wavelengths penetrate deeper. So you, just as importantly as the SPF, but really more importantly, you want a broad spectrum sunscreen that covers UVA and UVB. So you can't only count on your SPF number. I'll take it one step further. You want a sunscreen that will also block visible light, because visible light can also cause cancer and will age you, and people don't think about that. So you want a sunscreen that has a physical blocking agent, zinc oxide or titanium dioxide. And actually you want both, because a combination of both will completely cover UVA and UVB. And you want iron oxide in your sunscreen because that will filter visible light. But let me take it one step further. There are many other things in the atmosphere that will injure your skin and age you and cause cancer. There's infrared radiation, there's ozone, there's air pollution, there's cigarette smoke, there's particulate debris. They all injure your skin the same way. The mechanism of action is oxidative injury, free radical oxidative reactions. So if there's one common mechanism between UVA, UVB, visible light, infrared radiation, ozone, air pollution that injure your skin, then there's one common protective mechanism, and that's an antioxidant. So I have all my patients, even my teenage patients, not only use sunscreen, but use topical antioxidants on their skin. And then you're getting a much broader spectrum of protection than just a sunscreen. So think of protecting yourself against cancer and aging is really a two-step process: topical antioxidants and then broad spectrum sunscreen.